Let's talk about herpes viruses. So they're enveloped, double-stranded, and linear viruses. And there's herpes simplex 1. That's going to be like your gingivostomatitis, keratoconjunctivitis, and herpes labialis, like cold sores on your lip. Herpetic whitlow on the finger, temporal lobe encephalitis, esophagitis, erythema multiforme. And so in our question stem here, we'll have bilateral hemorrhagic necrosis of the temporal lobes and fever. And they're going to be asking about what disease is this? It's HSV1 encephalitis, and it's not toxo, even though you might see like a cat. And typically with the cat, you think, toxo. But in this case, we got a previously healthy child, not immunocompromised, a fever, seizure, and then altered mental status and temporal lobe necrosis on autopsy. HSV1 loves medial and inferior temporal lobes, and you might have like aphasia, disorientation. It's diagnosed by the CSF, PCR, or HSV, treated with acyclovir. So here's our little baby, our 10-year-old, developing seizures, confusion, and dies with bilateral temporal necrosis. What's the cause? HSV1. Why? It reached the brain through the olfactory tract, through the trigeminal ganglion, and it caused necrosis. Let's look at some trap answers, but before we do that, let's talk about like herpes simplex 2. That's transmitted by sexual contact, and the clinical significance for 2 is it's going to be herpes genitalis and neonatal herpes. So on a little baby, you might see that. Varicella zoster is going to be your 3. That's respiratory secretions in contact with the fluid from vesicles. And, that's classically known as shingles, and chickenpox, encephalitis can be associated with varicella zoster. And other than that, it's pretty much what we need to know about 3. For 4, it's mononucleosis, so fever, hepatosplenomegaly, pharyngitis, lymphadenopathies associated with lymphomas like Burkitt's, nasopharyngeal carcinoma, especially in Asian adults. This is the kissing disease. That's mono, would be 4. And 4 infects the B cells, so must be 21 to be able to drink beer at a bar. Epstein-Barr virus infects the B cells. And then 5 is cytomegalovirus. 6 and 7, those are going to be transmitted through saliva. That's like roseola infantum, and fever first, rosy later. And then also 8, that's going to be leading to Kaposi sarcoma through sexual contact. All right, so that's a little lowdown on the herpes. So now let's talk about trap answers. Toxo. You could think like cat equals toxo, but toxo usually affects the immunocompromised patients, like those with AIDS. And that our patient in this question did not have it. Ring-enhancing lesions are going to be seen. Yes, it's in cat litter, but the child is immunocompetent and has temporal lobe necrosis, not ring lesions here. All right, so the child, usually with toxo, you'd have them be immunocompromised, not just like healthy and then they get a disease. Enterovirus is the most common cause of viral meningitis in kids. And it may cause encephalitis, but not temporal lobe necrosis. Temporal lobe necrosis is only this HSV1, so it wouldn't be enterovirus. All right, Naegleria fowleri, that one is the freshwater one, swimming in a lake, enters through the cribriform plate. And so that can be commonly mistaken with the trigeminal ganglia through HSV1, but this is the cribriform plate, and can cause fulminant meningoencephalitis, and it's not temporal lobe associated with that hemorrhagic necrosis. Neisseria meningitidis, that's how I pronounce it. Classic bacterial meningitis symptoms: fever, nuchal rigidity, petechia. Doesn't destroy the brain tissue. So the brain tissue in that necrosis of the temporal lobe is super important. Streptococcus pneumonia, another top cause of bacterial meningitis, no temporal lobe necrosis. All right, so here we go. Here's our little sheet. Basically, what we know for HSV is it's going to affect the healthy adults and kids. The route is olfactory through the trigeminal ganglion. And in autopsy, you're going to see a temporal lobe hemorrhagic necrosis, fever, and seizures, and aphasia, AMS, and also a diagnosis is in the CSF and PCR, and you treat it with acyclovir. So hopefully that was helpful. If it was, go ahead and like and subscribe for more contento.